healthcare. Well, hospitals in North Carolina are suing patients for unpaid medical debt. In some cases, people could lose their homes. A new report names several local hospitals as repeat offenders for lawsuits against patients. Queen City News anchor Casey Jones joins us now, looking into these lawsuits and how they impact people locally.
Well, researchers combed through 5 years of court documents and found 5 hospitals were responsible for the majority of lawsuits. There were thousands of lawsuits filed, and on average, people were forced to pay up more than $16,000 or lose their homes and other assets. A new report shows facilities designed to save lives could be ruining them.
There are a lot of patients who are really, their financial trajectory is kind of ruined by what happened, and there's not much to do.
North Carolina researchers combed through 5 years of court documents that revealed hospitals are suing patients for medical debt.
And they're in a vortex that eventually is going to destroy their credit score.
North Carolina law allows hospitals to charge up to 8% interest on unpaid medical bills. Wednesday, researchers and the state treasurer talked about the impact of the debt. A 70-year-old couple owes close to $200,000 in medical bills after the husband's visit to a hospital that later merged with Atrium. The pair couldn't afford the bill. Now they've accrued more than $100,000 in interest. The couple says they were denied financial assistance from the hospital.
Our research does speak to the health system that the state has. The way patients are charged for care, the prices that the market bears, the lack of transparency that patients encounter when they consume healthcare, the way healthcare is financed, and the very significant holes in our safety net.
Atrium Health sent a statement saying, in part, in 2021, they provided more than $2 billion worth of free health care. The statement went on to say, as current practice, Atrium Health does not file lawsuits against patients. Community Health and Caramont say they file lawsuits as a last resort for unpaid bills.
This is like an onion. The more we peel, the more we cry. That's why the Medical Debt De-Weaponization Act is so vitally important to actually protect the consumers of our state and catapult us to number 2 in the country in terms of consumer protection.
The Medical Debt De-Weaponization Act would protect consumers by limiting interest on medical bills, ending liability for spouses and other family members, while prohibiting the sale of medical debt to third parties.
This is a logical, conservative, common sense approach to how we need to deal with this.
So what's the status of the Medical Debt De-Weaponization Act? It passed the Senate, but it didn't get a lot of traction in the House, but that doesn't mean it won't happen. The state treasurer encourages all representatives to just think about how people in their district would benefit from a protection like this. Another thing I want to point out to you is about Atrium. The research shows that Atrium was the worst offender named as plaintiff in more than 2,400 lawsuits. They claim that as a current practice, they do not sue patients. We are still asking questions, trying to understand if that policy changed, and if so, when. Brian?
Well, Casey, though, you listened in on today's meeting about this. Was there any guidance on what people should do if they have a significant amount of medical debt?
Well, experts say the first thing to do is communicate to the hospital that you're having trouble paying whatever amount you owe. Some hospitals do have financial assistance plans so that you can avoid any litigation. If you feel like a hospital has unfairly targeted or charged you, reach out to the treasurer's office. They continue to collect these stories, and patients can reach out there. Another thing I want to point out is these hospitals get billions of dollars in tax breaks. That's why the treasurer is stepping in on this. Alicia?